Overall, as you've already heard from the Minister and Dr. Moore, we are seeing some encouraging signs, but we remain in a very challenging environment and we're not out of the woods yet. Just to highlight a few of the measures that we're monitoring that do point to some hopeful signs. As you've heard from Dr. Moore, we're seeing relatively fewer people requiring intensive care. Over the last few weeks, the total ICU occupancy has remained relatively constant. Today, we have a total of 571 COVID-positive patients in our ICUs, compared to a high of just under 900 at the peak of Wave 3. We're also seeing that patients have a shorter length of stay in our ICU, and this is helping to limit the overall rise of the numbers in our ICUs. On the acute care side, where we have our biggest challenge is in our ward beds or hospital beds. We currently have more than 4,100 COVID-positive patients in our hospitals. This is the highest total of hospitalizations we've seen throughout the pandemic. And over the last 7 days, fortunately, we are starting to see some slowing of that growth. As noted by Dr. Moore, it's still growing, but the rate that is growing each day seems to be slowing. These are encouraging signs. However, it's important to remember that even while with these key measures are trending in the right direction, we don't feel that in the hospitals. We don't realize these benefits for a number of more weeks. We still have hospitals that are under very challenging circumstances as we deal with these rising numbers. As the Minister has indicated, our health system will likely continue to experience challenges through February. A particular and unique challenge of this wave has been related to sick call as it relates to COVID in many of our healthcare settings. It's affecting all sectors and continues to add strain on the remaining staff. This includes our community care centers, our community support service, home care, and hospitals across the province. Primary care has also been affected. However, they continue to do amazing work to support our vaccination efforts. And we are seeing that they're continuing to try to grow their in-person supportive care. Thankfully, we are seeing some signs that absentee due to COVID may be stabilizing. We do have a number of agencies across the province saying that they're experiencing that they now have more staff coming back than are on sick call that day. An encouraging sign, but again, something we're going to have to watch. We continue to face pressures in some of our hotspot hospitals. We do have a number of hospitals that are operating at over 100% occupancy in their ward beds. Through our regional incident management systems, we have been transferring patients to try to load balance and to try to ensure a safe duty of care for all patients who are coming into, all people who are coming into our hospitals. Last week alone, we did over 100 transfers. In other waves, as in other waves, we are using the full resources of our provincial health system. This has been key to our efforts to ensure Ontarians get the care they need. We recognize that with the difficult decisions that we've had to make over the last few weeks, this has had a tremendous impact on all of us and on our families. Most of us, if not all of us, know someone who is waiting for care. These are difficult choices through this phase of the pandemic. Along with our ministry and government colleagues, we remain focused on addressing delayed care as soon as we possibly can. In closing, I just want to echo the Minister's thanks to our healthcare workers. Our system has been under strain for almost 2 years now, and yet our front line has not wavered in their dedication and commitment to patients. Thank you to our healthcare providers across the entire healthcare system, our community care, primary care, long-term care, home care, and acute care hospital workers. All of you have continued to do your part to keep our system running and caring for patients.